Hello, I'm Dr. Stephen Blomerth, and you're watching Natural Health Today. And this is a show that helps talk about your health problems, your concerns, your questions about yourself or a family member. And we invite you to participate in the show. And you can participate in either three ways. You can send your questions into pbdchiropractic@gmail.com. Or you can call my office at 978-535-6155. Or you can send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. But whichever way you choose to participate in the show, we'll slightly disguise your name so your friends and neighbors won't know necessarily the problem that you may have. But what we do is we talk about natural health means that may be able to help you. Because 80 to 90% of day-to-day health pains and problems don't require drugs, don't require surgery, and they can be helped by natural health means. And when I use the term natural health, I think of four avenues, four methods by which most natural health can be delivered. One is by manipulation of stuck joints. When a joint is stuck, it might be just stuck in one particular area, but it can have far-reaching effects. A shoulder joint problem can cause a neck problem. A neck problem can radiate and cause a problem in a shoulder. And many times, just freeing up a joint is enough to relieve a host of different symptoms. And so it is also with muscle work. And I'm not talking about just simple massage. I'm talking about finding trigger points and tight areas in the body that impede movement, because our body and our muscles are designed to move smoothly without pain and without hitches or without knots in the muscles. When you have a knot in a muscle, you might not even feel the symptom in that particular muscle. It may result in improper function or discomfort in a totally different area. So muscle work is another avenue of natural health care. Another way is exercise. I'm not talking about stereotypical exercising at the gym, because most times that kind of exercising is long-term counterproductive. I'm talking about doing stabilization exercises which combine some degree of stretching and some degree of strengthening of muscles that are chronically weak. We have certain muscles in our body that we use all the time. Those are the muscles that don't need to be strengthened anymore. We have certain other muscles in our body that help us stabilize an area, and many times they don't get enough work. So we talk about foundation training exercises and teach our patients those exercises, because you don't need any equipment, you don't need to belong to a gym, and you don't need to be particularly athletic to learn to use them. And the last avenue of natural health care I call nutrition. Now, nutrition to some people is what supplements you take. Supplementation via vitamins, herbs, or minerals is not a bad idea for some people, but also a lot of what nutrition is what to eat, and in particular what not to eat, because you can have far-reaching improvement with a person just by eating the right foods, by taking some supplements if needed, and even by eating on a certain basis. For instance, not going long intervals without eating. All those four avenues go into what I call natural health care. So I'm going to put on my reading glasses, and we'll have a look at some of the questions that have come in since our last episode, and we'll see if there's some way that we can help some of these people. Not everybody is helped by natural health care, but a lot of people can be. Okay, Louise writes in from Middleton. She says, I woke up last Sunday and noticed that I had a black and blue spot down near my belly button. I haven't fallen, and I don't remember doing anything strenuous. This black and blue spot is about the size of a tennis ball, and it's not painful, and I don't feel sick. Any ideas? Well, when a person talks about a black and blue spot any place on their body, that's a sign that some blood vessels have broken and there's some blood leaking, because when we see a black and blue spot on the surface, something has happened underneath. Most of us are familiar with getting a bruise from an activity, like somebody punches you in the shoulder, or you fall down and you hit something with your knee or your leg. And you've seen in the days after that activity a black and blue spot happen. That black and blue spot is where some blood vessels have leaked and some of the cells, the red blood cells, have come to the surface, and that's what gives that blue spot that you see in a bruise. But with Louise, she says she didn't have any strenuous activity, she didn't have any trauma, she just woke up with a black and blue spot about the size of a tennis ball down by her abdomen. Well, that's not the thing that you can readily help with quote-unquote natural health care. When you have a black and blue spot down in your abdomen, it means some blood vessels have been leaking inside your abdominal cavity. Which ones? It's very hard to say. But when blood vessels leak and the red blood cells come to the surface, they form that blue spot, and that's a sign that you have a problem. Now, it is a good thing that you don't feel feverish, you don't feel ill, but something is wrong inside you. It's not something that you can readily diagnose yourself. I know plenty of people would turn to Google or look up on the internet and try to find a bruise on the abdomen and get a response from that and see if they can treat it themselves. That's not the type of thing that I would try to self-treat. I would consult with your medical doctor, and if he's too busy to see you, I would go to the emergency room and have them run a test. And I know when you go to the emergency room, if you're not sick, dying, feverish, or broken bone, it's hard to get some attention. But a black and blue spot down in your abdomen is an indication that something is bleeding, something is not well inside. Which organ is it? Is it your spleen? Is it your pancreas? Very hard to say, but something is wrong inside. It's a good thing that you don't feel sick. It's a good thing you don't feel pain. It's a good thing that you don't feel feverish. Something is wrong. You need an exam. You may need a blood test. You may need a CT scan or an ultrasound. But that's the type of thing that I would not leave to natural health care. As I said, natural health care doesn't fix everything. We probably fix 90% of day-to-day health care problems. But Louise, that's not a day-to-day health care problem. That's a very unusual presentation. It's very common to get a bruise when we get hit, but not very common to not recall any trauma, not be taking any blood thinners, and just come up with bleeding down your abdomen. I wouldn't delay. I would consult with your medical doctor as soon as possible. But thanks for that question. Okay. The next question is from Ron. Ron writes in from Danvers Highlands. He says, I have left knee pain starting about 2 weeks ago. It happens mainly when I'm sitting. I went to my primary care doctor, and he said it sounded like a meniscus problem, and he referred me to a friend of his to have an MRI. But I really don't want to have surgery because a friend of mine had that surgery 5 years ago, and he still has pain. So what can I do? My knee hurts a little bit more when I'm wearing a knee brace. Okay. Well, Ron, when you have pain in your knee when you're sitting, it tells me that you don't have a normal knee pain. Knee pain, if it's true knee pain that's coming from the knee, it'll hurt you. If it doesn't hurt you when you walk, it'll hurt you when you're going upstairs, and in particular, it'll hurt you when you're going downstairs. If none of those things are true, and if it only hurts you when you're sitting, there's something about the way you're sitting that is either provoking your pain or your pain is being radiated from someplace else. So this is the type of situation where it's hard to come up with an immediate diagnosis based on your symptoms and based on what brings out your pain. But Ron also says that his knee hurts a little bit more when he's wearing a knee brace. So when you have more pain in your knee from your brace, it means your brace is too tight, it's restricting blood flow, and it may be that you're having pain in your knee because you're not getting adequate blood flow to that area. Ron, and to our viewers watching the show, this is another example of a very atypical situation. When we have pain in our knee, there's usually either a cause or a symptom that gives it away as a true knee problem. For instance, walking or going up and down stairs, but pain in your knee on sitting, that's very unusual unless you have some type of a pain from radiation from the back down into the knee. An MRI of the knee is unlikely to bring out any information about your knee, because I don't think your knee is your problem, particularly when you get your pain when you're sitting. If I was to do anything, I would want to have an MRI of your low back. So Ron, you have another situation that's very unusual. If you're having pain when you're sitting, one of the things you can try is putting some ice on that area, but this is something that I wouldn't go back to your medical doctor, because talking about you having a meniscus problem when you didn't have any history of trauma to that area means that you should probably consult with a knee specialist rather than your regular MD internist, because he doesn't sound like he was adequately listening to you when you were telling him your history, that you didn't do anything to hurt it. So thanks a lot for that question. Let's go on to our next question, and our next question comes from Jessica from West Peabody. Jessica writes in, she says, my daughter plays volleyball and she's just getting over having a bad back. Jessica says, how soon after you have a bad back is it okay to start exercising? I know she really wants to get strong for the volleyball team this season. Well, Jessica, you don't have to wait to start exercising if you have a bad back. You can exercise while you're having a bad back, as long as you do the right exercises. Here's how to judge your exercise program while you're having a bad back. If you do an exercise that brings out your back pain, then that's an inappropriate exercise and it's premature. But if you're doing the right exercises, and particularly the foundation training exercises that we recommend, when I do the foundation training exercises and I have back pain, my pain immediately goes down. It's very normal when we do any exercise that we're not used to get some discomfort. For instance, if I hadn't done a bunch of bicep exercises for my bicep and I was doing some exercises like this, I might feel some localized short-term discomfort in an area from doing an exercise that I hadn't done previously. That's normal, that's to be expected, and particularly if that discomfort doesn't last more than a few minutes immediately during and perhaps shortly after the exercise. If the pain immediately goes away and it only feels like a pain of doing an exercise in a muscle that hasn't been used much previously, that's perfectly fine. So for a person to wait until their back pain is gone, I think is foolish, because back pain can take quite a long time to resolve if you're not getting the right care. If you're not doing the right exercises, doing back exercises will make you worse. That's how to judge it. If you do an exercise that exactly duplicates your back pain or the reason that you consulted with somebody, then that exercise isn't appropriate for you at that time. If the exercise that you do just brings out some discomfort from the exercise, that's perfectly fine. I find that the foundation training exercises always make my back pain decrease, and I feel better after the exercise. So that's what I would do. Don't wait until your back pain is totally gone away. Try doing some of the foundation training exercises. You can find them online. One of my favorite ones that you can see for free on YouTube is called Independence from Pain. I know if you type it in on your computer, it'll probably come up the first time. Independence from Spain, but just type in Independence from Pain and then put in foundation training. The exercise lasts 7 minutes and 22 seconds. I find it's a very good exercise. Doesn't need any equipment at all. You just do them standing up, and they almost always will help your pain decrease. And I wouldn't wait till my pain was over. I would do the exercise while you're having a session of pain and see how you react. Most people, it feels better. But thanks for that question. I think your daughter, if she's normal and healthy and does the right exercises, should be able to get right back to playing volleyball as long as everything else is taken care of, including having somebody look at your feet, because volleyball does involve a lot of jumping. And if you have a problem with your foot, that foot problem may not even manifest itself as pain in the foot. It can just give you back pain. So go to somebody who knows not only the biomechanics of the back, but also the mechanics of the foot, and knows what to look for. Plenty of people have flat feet, and that can generate a certain amount of back pain as well. But thanks for that question. I hope your daughter is able to get back to the volleyball season. It's a fun game to play. Okay, next question comes from Paul. He writes in from Danvers. He says, I get these ear and these sinus infections a couple times a year. When I visit my brother who lives out by Springfield, I used to think it was my allergies to his cat, but he doesn't have a cat anymore. Is there anything I can do to stop that when I stay there for a visit? Well, it's a little bit interesting, because in Massachusetts, Springfield is a city that happens to sit in the Connecticut River Valley. And what a lot of people don't know is that the Connecticut River Valley has a very unhealthy air quality to it, because it sits in a valley, and unlike those of us who live here on the North Shore, very close to the sea, the air in our area is pretty constantly being changed by the different weather phenomenon that sweep through our area. And we're close to the sea, so allergens in the air constantly get pushed out to sea, whereas out by Springfield, they're sitting in a little valley like this. And in that valley, the air doesn't change over quite so readily as it does when we're here on the coast, where the breeze blows pollen and fungus and things like that tend to linger in the air. It pushes them out to sea. But Springfield and the Connecticut River Valley is a hotter place in the summer, a damper place in the winter, and has a higher pollen count and a higher fungal count all year long in the air. It may be just a problem that is endemic to that area, and there's not too much you can do. Things that can help sinus infections be better is avoiding dairy, and you may even want to go on a diet that's free of all animal products for a considerable amount of time, perhaps a month or 6 weeks. See how your symptoms are. Won't cost you anything, because sometimes people have sensitivities that cause them to have problems with their sinuses and back up into the ears just from certain foods that they eat. Giving up all animal products, and particularly dairy, for a month or 6 weeks may help out. Doesn't cost anything, and it certainly better for you than taking even over-the-counter drugs, which don't really correct your problem, just correct your symptoms. So thank you for that question, Paul. That was good. And we hope people won't all decide to give a call to Springfield and say, hey, what's up with that out there? It's just that Connecticut River Valley is an unfortunate area for some people. Okay, Judy writes in from Danversburg. She says, I've been having right shoulder problems for about 3 months. I had to stop working out, but it still hurts me, like when I'm putting on a jacket. Do you have any good exercises for a sore shoulder? Well, Judy, when a person has a sore shoulder, particularly when they didn't have a fall, when they didn't have trauma, it's likely that their exercises strained the stabilization muscles of the shoulder. We have different muscles around our shoulder, and some of them, like the large muscle that we see right on the outside here, this muscle is called the deltoid. That is a muscle that raises the shoulder up and down and helps it move. But we also have some small muscles underneath and surrounding that area that stabilize the shoulder. And if you've been working out a lot at the gym, many times what happens, we strengthen our deltoid and the muscles that help raise our shoulder, move our shoulder, but we overpower the little muscles underneath. Now what she said, she'd stopped working out for about 3 months and she's still having the pain. How does that come about? It comes about because once you've overpowered a certain muscle, you've made that muscle have scar tissue in it. And the reason there's scar tissue in it because you've instilled a certain degree of micro trauma to the muscle. The muscle is trying to repair itself, but it doesn't have a very good chance to repair itself because these muscles are small, they're inside. They don't get the good blood flow that we get when we're younger. Our blood vessels put out a certain amount of flow to all areas of our body all the time, and they tend to be greater when we're younger and less so the older we get. So if you've been not doing the exercise for about 3 months, you still may have this imbalance in there with scar tissue in the area. There's not much in terms of exercise that'll bring your shoulder back. What I can say is you definitely wouldn't want to be doing push-ups, you wouldn't want to be doing bench press, you wouldn't want to be doing this type of thing, the pec flies, or obviously the overhead exercises like that are going to be a bad idea for you to do. Exercises that you should do, well, anything that helps make your posture better. You might want to do some of the foundation training, decompression breathing, and do anything that helps you externally rotate, because most exercises have us turn in. Not too many exercises have us turn out. We get far too much internal rotation, not enough external rotation. When you have had a problem and it's persisted even though you stopped exercising for 3 months, it means the scar tissue in the joint, that needs to be worked out by hand, by finding the trigger points in that area, by knowing where the tendons lie and working on them. It's sort of a back and forth motion to break up those little knots in there and then allow them to heal. You can't do it every day because doing it every day doesn't give you healing time in between, but it could be done every other day or once or twice a week. I'm sorry I don't have a magic exercise for you to do to strengthen your shoulder, but I can say that any exercise that brings out your pain is going to be premature to go back to, and exercises that don't produce pain but do produce that external rotation should be fine. There's not too many of those, but you can find some of those, again, on foundationtraining.com. And that's about all the time we have for today, so I'd just like to thank you for watching Natural Health Today. I'm your host, Dr. Steve Blomerth. Natural Health show is dedicated to your questions and your health concerns, And we give you 3 different ways to participate in the show. You can send your questions via email to pvdchiropractic@gmail.com. You can telephone my office at 978-535-6155, or you can send an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. Whichever way you decide to participate in the show, we'll disguise your name a little bit. We'll read it, the question out, and then we'll try to give you some ways to help yourself. As you may have noticed today, several of our questions were things that couldn't really be helped so much by natural health means, but sometimes that's what a good doctor does. He gives his patients advice about when he can help them and when he can't help them, and when they need to seek more immediate, more high-tech imaging care to discern their problem. So thanks for watching. I'm Dr. Stephen Blomerth. Thanks for watching Natural Health Today. We'll see you next time. Bye-bye.